Diabetes, don't you think nowadays, it is widespread? I mean, every 2 in 3 individuals are suffering from this condition. Today let's learn about this disease in detail, and let's find out the causes of this fatal condition. Diabetes mellitus is the condition which arises due to persistent hyperglycemia, means increased blood glucose for longer period of time. It has 2 types: diabetes mellitus type 1 and diabetes mellitus type 2. Type 1 diabetes mellitus or insulin-dependent diabetes mellitus. An autoimmune condition where the immune system attacks insulin-producing beta cells in the pancreas, which causes insulin deficiency. Typically diagnosed in children and young adults, hence also known as juvenile onset diabetes. Causes. Exact cause is unclear, but genetic predisposition and environmental factors, like viral infections, may play a role. Symptoms. Rapid onset of symptoms. Increased thirst and frequent urination, polyuria. Extreme hunger, polyphagia. Unexplained weight loss. Fatigue and weakness. Ketoacidosis, a potentially life-threatening condition, can occur if untreated. Blurred vision. Type 2 diabetes mellitus, more common than type 1, usually develops in adults, therefore also known as maturity onset diabetes. Causes. Characterized by insulin resistance. Associated with obesity, physical inactivity, and genetic factors. Symptoms. Symptoms develop gradually and can be mild or absent initially. Increased thirst and frequent urination. Increased hunger. Fatigue. Blurred vision. Slow healing sores or frequent infections. Areas of darkened skin, acanthosis nigricans. Similarities in symptoms: both types can cause increased thirst, frequent urination, extreme hunger, fatigue, and blurred vision. Both can lead to long-term complications if not managed, such as cardiovascular disease, nerve damage, and kidney problems. Differences in symptoms onset: type 1 symptoms are rapid and acute. Type 2 symptoms are gradual and may be overlooked initially. Weight changes: type 1 often results in unexplained weight loss, whereas type 2 may involve weight gain or difficulty losing weight due to insulin resistance. Now you may have questioned why in type 1 there is weight loss, but in type 2 vice versa. This is because in type 1, due to lack of insulin, our cells will starve as they are not able to get glucose, due to which our body will break down stored fat and muscle for energy. However, in case type 2 there is increased production of insulin to compensate unresponsiveness of cells to insulin, due to which there is insulin-induced weight gain. Age of onset: type 1 usually diagnosed in children/young adults, while type 2 is more common in adults but increasingly seen in younger populations.